For Gracie, back pain was so bad, some mornings she struggled to even just get out of bed. When traditional surgery wasn't an option, a minimally invasive procedure helped to treat her pain. Here to explain, please welcome Dr. Pawan Grover and his patient, Gracie Patterson. All right, so Gracie, you just had some things in your life that you certainly didn't have time for back pain, but you have a special needs child, so you need to be able to handle that child, but there are days that was impossible for you.
Yes, it was. It really made me depressed that I wasn't able to care for my child. And I needed to be one step ahead of him all the time.
Right.
And with that back pain, I could not keep up with it.
Even going up the stairs, sometimes
Yes.
impossible?
I have 2 bedrooms upstairs, and he sometimes likes to go upstairs and spend the night, so I had to crawl up the stairs.
And it really broke your heart once when he was mimicking Mommy.
Yes, he's funny, and he always tried to help me. He's a very good child.
But he, in seeing you, the characteristic that he was mimicking was you in pain. And Dr. Grover, you hear this a lot from patients, because obviously when your back is out, you're just out of commission, period.
Right.
And there are traditional back surgeries, but sometimes those don't work. In fact, many times they might not work all the way because people aren't really identifying exactly where the problem is, and that's where you come in.
Right. Well, you know, MRIs and CAT scans are helpful, but they never show everything. For example, I've never seen an MRI that shows one problem. So we'll see problems with discs, we'll see problems with nerves. So how do you figure out which one of those is causing the problem? And we all know of sciatica, for example. It's pain coming from your sciatic nerve. But did you know that it doesn't really show up on most cases on a CAT scan or an MRI, so it gets missed. So the first step involves getting the root cause of the problem, and that involves a procedure we do with diagnostic mapping, which we're able to actually analyze different sections, block it, and get an analysis of how much % of pain is coming from what area.
Yeah.
Then once we know that, then we can, do something to fix that root cause.
Right. What was happening with Gracie?
What was happening with Gracie is that she was having compression in her spine, so because of degeneration, because of disc bulging, and so she couldn't walk. So every time she would walk, she'd have to sit down, but it really kind of put pressure on her nerves.
Yeah. In fact, you were using a walker at one time. Because
Yes.
And if you could get up, you had to use a walker.
And now that walker is in the attic.
Well, there you go. See, toss that walker. Okay, and part of the reason why it's in the attic is because you were able to identify exactly where her pain was coming from, and then how did you treat it?
Well, what we did is she had a mechanical problem, right? She had actual compression there on the nerves, and she actually developed 2 problems. She also had, later on, she had a sciatic area, so she had damage to her arthritis and degeneration problems in her sciatic nerve. So for the mechanical issue in her spine, we went in with a scope, and I actually took out bits of bone and tissue, so we opened up her spine. I think you were able to walk up, in a couple of days, up the steps.
Yeah, and when you said with a scope,
yes,
that's part of the key there, too, is you're not like slicing open like we did in the olden days. It's minimally invasive, and then a couple of days walking up the stairs. This must be like a whole new life for you now.
I got my life back.
And put the walker up in the attic.
With a Band-Aid.
Yeah, with a Band-Aid. I love it. So it makes sense. Who qualifies for this particular procedure? Is it somebody who's already been through the other ways of treating it, or do you want to get to them right away so they're not having more damage by waiting?
Well, of course, if we are able to get to the problems, ahead of time or earlier on, then we have able to resolve it before this whole cycle happens. So when you have pain down the leg, your body starts to shift its weight, you've got problems in the joints, so it leads to a chain reaction. So earlier is better, but if there's nerve damage or scar tissue, we can treat it later on as well.
Yeah, and it's important to know that not every doctor treats things the same way or has the same background or same education. And so important to kind of interview doctors and just make sure you're getting the right thing. And for you, the case was, if you can certainly pinpoint what the problem is, it makes sense, in basic medicine, pinpoint the problem, then you can take care of that problem.
That's right.
All right, Dr. Grover, thank you very much, and thank you. Congratulations on getting your life back, literally. For more information on Dr. Grover and minimally invasive procedures, call 832-371-1728, 832-371-1728, or log on to innovaspine.com. I just love that, a couple of days after back surgery, you're walking up the stairs. All right. Well, it's time to make a